In the United States alone, 1 in 2 males and 1 in 3 females will develop some form of cancer during their lifetime. In order to learn more about what exactly is putting Americans at a higher risk for getting cancer, we interviewed Dr. Mike McHale at the UC San Diego Moores Cancer Center.
A lot of times we're asked, what is cancer? I mean, regardless of where it may start, whether it's the skin or the lung or the intestine or in the uterus, we know that cancer is it's sophisticated in terms of how a cell goes from being normal to being a cancer. Requires oftentimes the accumulation of multiple mutations or mistakes within the DNA of a cell, and those mistakes can be brought upon by a genetic code, or they can be brought upon or stimulated by exposure to something in the environment. With respect to diet, I tell patients sometimes it's almost common sense, in that if it comes out of the ground, it's good for you. When it's not been processed over and over again, then those are foods that you should expose yourself to more frequently than anything. We all know that the sun, although it makes us feel good, we enjoy being out in the sun, we all enjoy having a little bit of a tone to our skin color. There are risks that are associated with being exposed to the sun too much. And, obviously melanoma is probably the skin cancer that is most concerning, because it's probably one of the more, if not the most aggressive type of cancer involving the skin that one can have. And unfortunately, a lot of the times that disease is diagnosed at what would, although very minimal amount of invasion within the skin, could put that patient at significant risk for not surviving their particular skin cancer. So that's another perfect example of how environmental factors can lead to cancer. Obesity. Obesity is a huge problem in the United States. We are in a world or an era where fast food is so readily available, and high volumes of fast food is readily available. People like to do the supersize, meals at McDonald's or what other fast food chains that they like to kind of frequent. But there are problems with that, because you're exposed to a number of products that your body just doesn't metabolize very well. And consequently you build up your fat stores. And there are a variety of cancers that are very much linked to obesity. And in the United States, from 1980 till 2010, our rates of obesity have almost tripled. In fact, we've gotten to the point where it's not just obesity now, it's considered super obesity. And there are a number of states in the United States that have, as a significant health issue, super obesity. Which is a problem, and not just for cancer, but for disease of the heart and the kidneys. There's a very, very direct correlation between smoking and exposure to the products within tobacco that raises one's risk for the development of lung cancer, as well as oral cancer and tongue cancer. And those are obviously very disfiguring cancers that oftentimes require very aggressive treatment. And unfortunately, the overall survival for some of those cancers, including lung cancer, is not very good.
In order to make an easy and entertaining way for people to learn more about cancer risk, we developed a game which uses probability to simulate cancer risk throughout your life. By playing our game, you will give yourself a better understanding of how the choices you make in life can dictate your personal risk of developing cancer.